Welcome, everybody, on our Zoom presentation of the state of dental hygiene education in Indiana. We're going to get started in just a minute. If you have questions that you'd like to ask Professor Rader, please feel free to put them in the chat. We'll get started in just a minute.
Evenly distributed statewide. So for example, Union County has 0 dental hygienists and 0 dentists. Urban counties are favored over the rural communities for practice by both dentists and hygienists. And then when we narrow it down to hygienists, you'll see that 98.9% of us are female. Our average age is 43. 5.2% of hygienists in the state are non-white. When it comes to practice settings, most frequently reported is a dental office or a dental practice. And then you'll see right here, 1% of dental hygienists report that they are educators. So that's a little concerning because 1% is a very, very low number. So let's talk about some employment characteristics. So most of these numbers were all taken from the Bowen Center's 2022 survey of oral health professionals. So 96.7% of us work in direct patient care, meaning we are actively taking care of patients. Most hygienists indicated that they're working enough hours. And only a little over 5% wanted to decrease their hours. So that's good. So that means that they're working as much as they want to work. Majority work in that solo or partnership practice. DSOs accommodate for about 4.5%. And then the number of hours that hygienists are working on a weekly basis. So if you look at this leaves 50% working 29 or less hours. So a lot of hygienists do work part-time. So these are some demographics by Indiana County. So this blue map is for dentists. Okay, so when you look at this, you see lots of different colors and you see some hash marks. Any place that you see those hash marks, that is an area where there is a health professional shortage, meaning that even though they do have dentists in that area, there's not enough per 5,000 people living in that county. So Crawford, Warren, and Union County do not have any practicing dentists. Some of these counties, so Pulaski County, I grew up in Winamac, Indiana. Small county, rural county, there is one dentist there and he is 80 years old. So we just don't have even distribution of our professionals. But then when we look at Marion County, we've got 600 dentists in Marion County. So now let's look at hygienists. So hygiene is in green, and you can see it's the same thing. The little hash marks mean this is a health professional shortage area. We have Union County. Over there in the corner that's gray, there are no hygienists that live in that county, but you'll see that Marion, Lake, Hamilton, and Allen have the most numbers of hygienists living in those communities. So, I mean, obviously they're the most heavily populated areas, but what about our other counties? What about our rural counties? How do we get students or professionals working in those communities? I don't have all the answers. I can't solve all those things, but it's something that we really do need to think about. So let's just narrow down and just talk about the dental hygiene programs that are here in Indiana. So there are 8. Columbus down here is brand new. They just opened this fall and they have 5 students because they have 5 dental chairs. If you'll see up here, the Indiana universities are bachelor degree programs as well as University of Southern Indiana. And then Ivy Tech offers an associate's degree. The numbers beside the names of the locations indicate the number of students that they accept per cohort. So something I think is really, really important when we talk about increasing our class size, because increasing our class size isn't just about the fact that we need to have more students in our classes. We need to be able to educate them. So take Anderson, for example, and I'm not picking on you, Dr. Hudson. There are 10 dental chairs in their clinic. They literally run clinic sessions 3 times a day because they have 10 chairs in their clinic. So many times these numbers are what they are because of the facility that that program has for their students. So if we would matriculate as hygiene faculty in the state of Indiana, matriculate all of these students on a yearly basis, that would be 155 hygienists being licensed every year. So you're going to hear me talk about something called CODA. Now, I know lots of times CODA gets a very bad rap, but CODA is actually a good thing, okay? It is a good thing because they set the standard for what we're teaching our students so that when our students leave, they are competent practitioners. So they set that bar where we have to be. So the other thing to know is that CODA is many times found in state statute. So when you go to try to get licensure or you're applying for licensure, you have to prove that you're a graduate of a CODA accredited program, because that means you've been taught what you need to know about dental hygiene in order to gain licensure. So let's just talk a little bit about some CODA requirements that we sometimes have difficulty with as educators. So they have very specific faculty to student ratios for dental hygiene. They don't necessarily have those same faculty to student ratios for dentistry, but it's clearly stated in our CODA standards that in preclinic clinical sessions, it needs to be a 1-to-5 faculty to student ratio. Now, there is an ad hoc committee developed to maybe increase that ratio from 1 to 6. So 1 faculty to 6 students in clinic. And that's all fine and good. But when I think about that, it doesn't really matter if you've got 10 chairs in your clinic or 15 chairs in your clinic. You're not going to be able to put more students in that clinic. You might have 1 faculty for less students. So it's not really going to increase those numbers. The one thing it is going to help is if you have a shortage of faculty, which is something else that we're experiencing. So you can see that we're, pretty mandated by what we can do in our clinics. And the other thing is all of our faculty have to have a bachelor's degree at minimum in order to be part-time faculty here at IUSD. So another thing that CODA is pretty sticky on is the number of enrolled students in your program has to be able to meet the benchmarks that CODA requires. So we have to have enough clinical chairs, laboratory stations, our clinic schedules. So all of our clinic schedules that you guys see in the bright colors, those all get shipped up to CODA when we do a site visit, because when we asked for our enrollment increase, I had to prove to them that we could do it. So they had to see how many faculty we had and that our faculty were qualified. So you can see that they really do want a lot of information, but they want this information for good reasons, because they want to make sure that the money that's being spent and the education that students are receiving is going to produce competent professionals. So let's talk just strictly about IUSD, because this is really what I know the best. So our program's a little bit different than the other programs in the state of Indiana, as our students graduate in December and they enter the workforce in January, which is really nice because nobody else is looking for a job at that time. In 2022, we were able to get license granted as early as January 3rd. So our students were ready to hit the floor running. Everyone stayed in Indiana except one relocated to Arizona. Our 2023 cohort indicated on their exit survey that they were all going to be staying in Indiana. And then when we asked where they were going to be practicing in that exit survey, you can see the distribution. It was mainly solo practice, group practice, and some corporate. So what have we done to try to address some of the workforce challenges here at IUSD? I did petition CODA, and we received permission from them to increase our class size to a maximum of 30. So our incoming class this fall, August of 2024, they will graduate in December of 2026, has 24 students. The reason why we accepted 24 instead of 30, there's several reasons, but one of those barriers was our clinical space. We have some building projects they are causing some shifts in clinics, so it's kind of like a real intricate chessboard in the clinic realm. And then I've got to make sure that I have enough faculty. Now, our faculty has increased over the last 2.5 years, but I also want to do this well. So I don't want to just go from 20 to 30 and do a poor job of that. I want our students to be successful. So being successful in the program starts really early, and it starts with the prerequisite courses. So these are the courses that are required to make application to the dental hygiene program. I know some people look at this and they're like, oh, wow, that's a lot of science classes. That's difficult to complete in 1 year, and it is tough to complete in 1 year. But the literature shows us and the data shows us that if students are successful in the biomedical science courses, then they're going to be successful in professional programs. So when we admit students here at the School of Dentistry, we want to make sure that they have the background knowledge in order to be successful. And the way we find it is through some of these courses. So what are some of our program goals that we have here for our hygiene program? Well, we want our students to learn how to provide comprehensive care in a variety of settings. I've got some students in the room. Would you guys agree that you see a variety of settings and a variety of patients? Yeah, we keep you pretty busy, right? We want our students to assume responsibility for oral health care, okay, and to educate their patients and to be able to prevent disease. We also want them to practice ethically and with legal consideration. And we want our students to leave here and understand that they really do need to be lifelong learners. I've been a clinician for 36 years. If I had not committed to being a lifelong learner, I would have been left in the dust, okay? Because there's so much new technology out there that if you don't stay on top of it, you don't know what you're missing. So let's talk about our student success rates because, we have pretty strict admission guidelines that we follow. So the NBDHE is the National Board Dental Hygiene Exam. It's an 8-hour written exam. We've had over 90% pass rate on this exam since 2015. We've had 100% on-time graduation since 2019. We've had 100% passing of the local board since 2015. The clinical boards on the simulation has been 100% passing since 2020, and the computer simulated OSCE has been 100%. So these are all things that are required for licensure. So if you look at the Indiana state statute, IC 25-13- I think 1-6, it talks about the credentials required for a dental hygienist to gain licensure in Indiana. First thing listed is you must be a graduate of a CODA accredited program. Number 2, you must pass the National Board Dental Hygiene exam and a clinical board exam. Okay, so we have really good success rates with our students. I think part of that is because our admission process is really, really strong. So what are the advantages to students coming to the School of Dentistry for the dental hygiene program? So this picture is actually the picture from 2018, I believe. This was the first class that graduated with a bachelor's degree from the School of Dentistry as their initial degree. What makes our program very different from most of the programs in the state is it's a year-round program. The dental schools open all year. So our students actually go to the first summer session. So 2 summer sessions allow them to graduate that semester early. They don't do that final spring. Our students enter the job market ahead of other students. And then because of our location being in Indianapolis, we have some external rotations that are unique. So we have an affiliation agreement with Indy HealthNet, where our students do 2 one-week rotations towards the end of their educational path to kind of get the feel of what it's like to work in a practice. Because in dental school and hygiene school, you typically schedule 1 patient in the morning, 1 patient in the afternoon. This is a situation where you've got more than 1 patient scheduled for you. You're working more with a team in a specific location. Another bonus that we have because we're of our location, our students are able to do rotations through Riley Hospital for Children. So they get a little bit of experience treating special needs kiddos. And then just because we're in the dental school, our students rotate through the pediatric clinic. They rotate through the periodontics clinic. So on that rotation, they might be seeing an implant being placed. They might see a bone graft being done. They might be seeing flap surgery. So they get experience in things in a much easier way because of where we're located and being inside the school. Another advantage to our program is we have a partnership with Fairbanks School of Public Health to offer 2 different tracks. We have 1 track in public health and 1 track in healthcare administration. So the difference between these 2 tracks is this. A public health dental hygienist is a hygienist who's probably going to stay in clinical practice, and she might be interested in working at an FQHC, which is a federally qualified healthcare center such as HealthNet. But this hygienist would have the ability to put together an educational program to address a health disparity that maybe she is seeing through the clinical chair that she's working out of. Maybe she's seeing a lot of gestational diabetes. Maybe she's seeing a lot of uncontrolled hypertension. She would have the background in order to put that presentation together. The healthcare administration track is for the hygienist who's really interested in the business side of dentistry. So this individual may not stay in clinical practice forever because we don't know what's going to happen down the road, but she might be interested in running a large DSO or something along those lines. So these 2 tracks actually give our students the ability to maybe have some opportunity outside of clinical practice if that's what they choose to do. So let's talk about licensure a little bit. So I've told you about the hygiene program here. So everybody knows what happened in 2020. Okay, March 2020, we sent our students home on spring break and they didn't come back until July. And then when we renewed our licenses in 2022, there were a lot of rumors going around that over 1,000 dental hygienists did not renew their licenses and that we were in big trouble. So if you look at these numbers, they come straight from the IPLA. You can see the renewals that were sent, the renewals that were actually renewed, and the rates that they were renewed. Cindy Vaught, who is the board director for the State Board of Dentistry and has been the board director for many years through the IPLA, was not concerned. She's like, this is a normal renewal rate for dentistry and dental hygiene. You always have people that are retiring and not renewing their licenses. You always have people that are moving and not renewing their licenses. So this really put us kind of into the situation where there were these workforce challenges. Okay, 2020 was tough with COVID, and we all kind of know what happened there. And so then let's fast forward to 2024. These are all of the renewals that were generated from the IPLA for our last renewal cycle just this past March. So lots of numbers. Some of them mean something to people. Some numbers don't mean a lot. But this is what's the most important. The renewal rate for hygienists was 99% in March of 2024. There were like 23 that didn't renew their licenses. So if you take 22 and 24 and you work those numbers and you get the differences, we actually have 353 more hygienists than we did that renewed in 2022. But those numbers change all the time because people apply for licenses, not just when the renewal happens. So the renewal rates in 24 were over or increased by 6% for dentists, 10% for hygienists. 96% of the hygienists in Indiana have local anesthesia permits. And as of that date in August 21st, there were 4421 dentists and 5258 hygienists. And I know those numbers are higher because we've granted licenses and state board meetings since then. So we are seeing an uptick in numbers. We're seeing a good renewal rate for hygiene and dental renewals. But we do still have these workforce challenges, and trying to come to terms with what is causing these workforce challenges was probably brewing before COVID happened. But I think COVID was really that cherry on the top. So let's just talk about some of the data that has come about since COVID. So some of the data that I'm using came from the Bowen Center. These are active links. So the Indiana Oral Health Workforce Data Report, and the ADA also did a health policy study as well, and I will be referring to that. So in some of these studies, they asked, what was the biggest reason why you left your practice? And you can see that, they're listed here, but the three that are asterisked are a negative workplace culture, being overworked, and insufficient pay. Now, I can't speak to what somebody considers insufficient pay, but if you're a hygienist that's been working in a practice for several years and you've never been given a raise, that might be an issue. So this is what came out of that survey. But some other things came out of it too. Why do you stay? Why do you want to be a hygienist? And these are the reasons that were given: work-life balance, positive workplace culture, and that ability to help patients. And I see this in the reflection pieces that students write. I see that in their personal statements when they're making application to school. Dental hygienists have that inherent desire to help people. And so if they're given a good workplace, they're going to stay and they're going to do a good job for you and your patients. And so what are some of the retention strategies that dental practices maybe can incorporate to retain their staff? So we see a big disparity between the benefits in dental practices aligning with other industries. Now, I completely understand what it's like to be a solo practitioner. A solo practitioner doesn't, they don't have some of the abilities that maybe Indiana University does to offer those benefit packages. It's tough being that individual practitioner. Assess wages at least annually. Have an annual review for your staff. Offer some growth opportunities. And make sure that workplace culture and work-life balance is good for your staff. So these are just some other strategies that I kind of brainstormed. So dentists, you need to provide good equipment for your hygienists. So have a policy on when you renew or when you purchase new instruments, or maybe purchase new technology, because there's some new technology on the market that is going to make dental hygiene an easier job. So we just purchased here at the School of Dentistry a piece of equipment called the EMS Guided Biofilm Therapy System. And I really think that it might have the ability to make a difference and make a hygienist's job a little bit easier, Because let's face it, scaling teeth by hand every day creates a lot of neck, shoulder, wrist, finger strain. I think this device and some of the new technology that's out, the new piezos, some of the air polishers are a good thing to look into. Practices need to foster good teamwork and communication. Communication is sometimes really, really hard when you have dissension in the ranks. So, do some things that make working there fun and address issues. I know I've worked in several practices through my career, and I always found that, when there was an issue at hand, nobody wanted to talk about it. They just kind of wanted to sweep it under the rug and let it go. And that only made it worse, right? So address those things early on rather than later. Make your hygiene schedule manageable. So I hear from hygienists in practice, I read things in social media, and I hear them talking about how I didn't have a lunch hour, I didn't have time to go to the bathroom. So make that hygiene schedule manageable. And then maybe reasonable working hours and flexibility. I think it's awfully hard to work a 12-hour day or a 10-hour day without taking some breaks. And then let's talk about benefits. So in the Health Policy Institute study, they revealed common benefits and uncommon benefits for dental practices. And I completely agree. I think, there's kind of a variation between, what is offered for benefits. But one thing I think is really important is when you have a staff and you're offering benefits, you need to offer benefits to everyone, and they need to be equal to everyone working in that practice. So say one person really needs health insurance, but another person in your office doesn't need health insurance. You need to balance that somehow. So sometimes you have to be a little creative when you're thinking about benefits. So, just kind of thinking outside of the box. Maybe if you're not offering a health insurance plan, maybe give a stipend to one of your staff members to go towards health insurance. Maybe life insurance or a short-term disability policy. Maybe a gym membership. Maybe they don't need any of these things, but you're offering them to other staff members, so you need to be equal in what you're doing for your staff. Maybe some tuition reimbursement for that new grad that's paying off student loans. But give the employees, I should say employees, the ability to choose when and how to use those benefits and build that benefit package so it's inclusive to everyone. And you've got to be fair with all staff members, because if you're not, the water cooler talk is going to come out, and it's going to be found that you're doing this for this person and this for this person and not this for that person. And that creates issues all the way around. And document that benefit package. Okay, so when I practiced in a small practice. And when I started teaching full-time at the school, Indiana University does this really cool little benefit package. And they list, your base pay, and these are your benefits, and this is like the total compensation. And, it's quite shocking because, in academia, it's a lot different than private practice. But then when you look at that final number at the end, it's like, oh, well, this is worth it because of all these benefits that I'm seeing. So I think you have to kind of put it in writing so your staff can see that. They may just be hearing, oh, you're paying me this much money an hour, when there's a lot of other things that go into it. So I pulled some things off social media when things were very heated with the workforce issue. And you guys can read for yourselves what is kind of out there. And I truly think that hygienists that have existing benefits and good pay, they're not going to leave their jobs to take a new job. It's just that simple. Okay. I was very blessed. I worked for the same dentist for 28 years. he treated me well. I loved my patients. We got along well in the office. And I just think that we've seen a big shift when it comes to dental staff. And I think the critical shortage now is even assisting. I think assisting has gotten even worse than hygiene. But COVID happened, and COVID forced some people to make some decisions. So dental practices closed, and when they reopened, some practices they didn't have the PPE. And so hygienists were working without the correct PPE. And then what happened with our schools and daycares? Schools and daycares were closed for a very, very long time. Who stays home and takes care of kids? Moms do. So I think there were a lot of hygienists that were home for a long period of time. And they kind of realized that, wow, gosh, now it's time to go back to work. I wasn't really thrilled with where I was working. And I think I want to do something different because obviously my family can survive on less money. So maybe I'm going to sub instead of taking a permanent position. So we're seeing a lot of hygienists that are subbing. And this is great because those hygienists can pick and choose the hours they want to work. They can pick and choose the days that they want to work. One thing that I don't agree with is some of the wages that are being asked for temping, because if you have any business mind, it's just out of the ballpark. And that's all I'm going to say about that. But, you know, COVID really made people take a step back and look. There were people that did not go back to dental hygiene because of a comorbidity themselves. So I think we just had this all brewing for a long time, and COVID really kind of made that come to play. So COVID had a huge impact on dentistry and medical and every other job out there. So you've probably, seen in the news where medical schools or nursing schools are increasing their numbers because they desperately need nurses. I hope that works for them. Their educational process is a lot different because they can send nurses out into hospitals for their clinical experiences, where we do everything in-house. And this workforce issue that we have with dental hygiene and dental assisting, it's not just in Indiana, it's across the country. I've talked to a number of program directors in the last few months. I was just at a conference a couple of weeks ago, talked to other program directors there. They have the same things occurring in their states as well. So one thing COVID did, it forced individuals to take a good long look at their working environments, and some people just chose to leave the profession. So what we really need to do is we just need to foster this positive work environment, offer some growth opportunities, and fulfill those professional needs, and you're going to have a happy staff. So that's all that I have for you today. But does anybody have any questions for me? Yes, Dr. Weingarten.
First off, I have two questions.
Sure.
Great presentation. First question is, can I get into your program without a blonde ponytail?
No, I'm sorry. A blonde ponytail is a prerequisite for the dental hygiene program, Dr. Weingarten.
To your students. The real question is, you talked about the percentage of,
Go ahead.
talk about the percentage of renewal for hygienists. You talked about the percentage of renewal for hygienists. You alluded to the fact that they may not come back full time. Do you have any statistics that show how many or what number of days a week during the week that the hygienists are working?
So in one of the earlier slides, it talked about the number of hours that hygienists were working. So about 50% are working less than 29 hours.
Relative to?
I don't know that. I don't know that. Dr. Platt.
From a salary perspective, have you ever compared the hygiene salaries to like ICU RN salaries?
So the question from Dr. Platt is, have I ever compared a dental hygienist salary to like an ICU nurse's salary? And you know what? No, I never have. But guess what? I will now. Yes, sir.
I've seen the numbers on how much debt dental students are coming out of school with. How much debt are your average hygienes?
Oh, that's an
Hygienists?
excellent question. And our exit survey covers that. So the question was, there's a lot of information out there about dental students' debt and what they're coming out with. His question is, what are hygiene students coming out with? Remember, it's a bachelor's degree, so it's about half as long, so 4 years. I believe on our exit survey from the class of 2023, the maximum amount of debt that that class had was $50,000. What about you guys in the
Do you want honest answers?
yes, so there's some hygiene students here in the room. So anybody got an idea?
Mine was 30,000.
Okay, we've got 30,000. This is a student graduating in December.
It's about the same, but I've gone to school for about 8 years, and I also got the GI Bill through my dad for the military. So I had free tuition
Okay.
first 4 years.
So we have another student in the classroom that was able to use the GI Bill, and she's about 30,000 because she's been in school off and on for 8 years.
Mine's about 82,000, 83,000.
Okay, and then I have another student in the classroom graduating in December. She's about 82, 83,000. So I think it varies across the board. I think it makes a difference in whether that hygiene student did their prerequisite courses in 1 year or 2 years, and then spent 2.5 years here with us. But obviously the debt's going to be a lot less with dental hygiene than it is with dentistry. Yes.
I have a question or more of something I think we need to think about because you mentioned, we need more faculty or hygienists geared towards academia. And the reason how I ended up where I was is because it was the associate's degree and the bachelor's degree track that was focused on teaching. That is not really a course anymore because you mentioned it's the public health track or this business administrative track. So we don't really have the opportunity for students to see what it would be like to be a dental hygiene educator. And if you don't see it, you probably won't do it because that's how I ended up where I was.
So when we first went to the bachelor's degree, we actually had 3 tracks. We had an education track, we had the public health track, and the healthcare administration track. I don't remember the exact specifics, but we got rid of the education track just because there was an issue with how do we put a student on the clinic floor with another student and have them give an evaluation. And that was a tough thing. And so it was just kind of dismantled. We do have our degree completion program. And this program is for associate degreed hygienists who are wanting to earn their bachelor's degree. It's probably the easiest track for an associate degreed hygienist to gain their bachelor's degree because most of the courses are offered as online courses or asynchronous courses. You do have to complete your general education core. And then when you get to a certain point, you can either determine whether you would like to be a student teacher for a semester or whether you'd like to do a community project. So we do have the ability to teach some education in that respect through that degree completion program. But since we've gone to a bachelor's degree for all of our students, our degree completion program is very small. And so we do recruit from Ivy Tech because those are our only associate degree hygienists here that are active, in the state. There's plenty of hygienists that have associate's degrees, but they may be at a point in their career that they don't want to get a bachelor's degree. Yes.
I've seen offices that instead of doing an hourly rate, they pay their hygienist based off of the patients that they do in a day, based off the procedures that they do and the amount that they make off of that. Have you ever seen the satisfaction from the hygienist on which one?
So I think so the question in the room is, have I ever seen a hygienist be paid different than an hourly rate, maybe based upon the patients that you see, or maybe what you charge out of your chair? That would be called commission. Okay. I actually worked on commission for a long time. And it was very successful for me because I worked in a well-established practice. I worked for a practice that had a fantastic recall system. We were literally 2 blocks away from DePauw University, so a lot of our patients worked on DePauw's campus. So it was very rare that my chair was empty. I don't think commission works well in a lot of practices just because if you don't have a patient in your chair, you're unemployed. At least that's how it was for me. It was very successful for me, but just because it was a good recall system.
As a business owner, it would probably be best to do the hourly instead of commission, you think? It would be like.
My personal opinion is I think an hourly rate is, or at least this is what I encourage the dental hygiene students to seek, is an hourly rate. And then take into consideration what benefits your employer is offering you. Because, so what if they offer you $50 an hour? That's probably it, because that's a pretty high salary. But if you're getting a lot of benefits in with that, you can expect that hourly rate's going to be a little bit less. And is it important for you to have holidays off and be paid for them? Is it important for you to have a vacation and get paid for that vacation? I mean, those are things that I can't choose for people, but if you're getting those benefits, they have to come somewhere. They have to come somewhere. You can't get both. You can't get an exorbitant salary and a ton of benefits. There's got to be a little give and take there. Anybody else? Yes, Marika.
Can you explain a little bit how temping as a hygienist works as far as like compensation and pay legally?
Okay, so the question was, how does temping work and how do you get paid legally? Okay, so number one, we are not a 1099. We are required to work under the direct supervision of a dentist. So they cannot not take out taxes. They have to do that. When you agree to temp in a practice, you would agree to an hourly rate. You would also need to agree to when you're going to be paid. Are they sending it to their payroll service? Are they cutting you a check that day? But you need to have taxes taken out of that check. We do not work as a 1099.
So like filling out a W-2.
Correct. Fill out a W-2. Yes.
We have one question from the Zoom gang, the Zoom watchers. Out of the class of 24, what is the expected dropout before graduation?
The class of 24, well, they graduate in just a few weeks.
Class size.
Oh. Now, ask that again, the class of 20,
My
the
class is-
size of 24.
Yeah.
What do I anticipate the dropout to be? Well, 0. I mean, we haven't even been in school for a semester, so I anticipate that they're all going to be successful. I may be wrong.
I think also maybe the answer is just we have very few students withdraw from the programs.
Yeah, we haven't had any attrition in our program for several years. So I really anticipate that they'll be successful. I might have just like jinxed us, but I mean, we don't know at this point, but we used our same admission process that we've used for years, and it has been successful. So we're hopeful that it will be successful. Now, is there concern that as you increase your class size, that you may experience attrition? Absolutely. Absolutely. And I think that you just have to have that admission process that you're able to select the best candidates for the program based upon what we're looking for, which is science GPA, interview, prerequisite GPA, and personal statement, and make sure that those students are prepared for the rigors of the program, because it's not easy. You know, those prerequisite courses are not easy. And it's even harder when you get here because your first semester is 15 credit hours.
So what I concluded from your lecture is that, tell me if I'm right or wrong, is that the same or maybe even higher, very close to the same number of people, of hygienists, are renewing their licenses. But that doesn't necessarily mean they're going back to work. They're just keeping their license current.
Possibly, yes. Or they're just not working as much.
And that's why there's still this gap.
Yes. Yes. And I think, you know, just like, you know, I think about the carries process, you know, you guys all know that it's multifactorial, right? I think this workforce issue is like a multi-factor issue. There's just a lot of things that go into it. And I think it all came to a head shortly after COVID. And, you know, we have put in, we can take up to 30 students, but I don't want to do a bad job of that. I want it to be good. I want the students that come here, I want them to be successful. I don't want to have attrition because school is expensive. It's very expensive. So I want them to succeed. So that's why, you know, we're going to take that enrollment increase in smaller steps and do it thoughtfully. Anybody else?
Thank you all so much for coming, and thank you so much to Professor Rader.
Thank you.